Have you noticed that your body responds differently as you age? Perhaps what was once a moment of pleasure and relaxation now generates doubt or even some discomfort. For many men over 60, the self-care routines that worked for decades no longer feel the same. Today, I want to talk to you about an intimate and fundamental topic for male well-being: masturbation after 60. I am Dr. Elena Castillo, and as a physician dedicated to the holistic health of older adults, I know that some conversations, although necessary, can be uncomfortable. But here, in our safe haven, we approach every aspect of your life with the seriousness, respect, and compassion you deserve. My experience has taught me that well-being is holistic, and intimacy in all its forms is a vital part of that. It's completely normal for the body to change. In fact, it's expected. With age, factors such as the natural decline of testosterone, alterations in blood flow, and decreased nerve sensitivity can transform the experience. Many of my patients, now over 70, have expressed concern about not knowing how to adapt their sex life and self-care. They are not alone. What was once an intuitive action now requires a little more awareness and adaptation. But this doesn't mean giving up pleasure or self-care. It means learning to listen to themselves and rediscover themselves in a more conscious and healthy way. Let me be very clear. We're not talking about giving up an important part of your life, but rather about refining it, adjusting it to this new stage. Imagine your skin. Over the years, it becomes thinner, less elastic, and perhaps drier. Natural lubrication may diminish. Now think of a touch that was once vigorous or quick. What was once stimulating and gratifying may now feel rough, irritating, or even painful. I remember a patient, let's call him Miguel, a 75-year-old man. He told me how, throughout his adult life, his masturbation technique had been quite vigorous, with lots of friction and consistent intensity. It was his routine, his tried and tested method. But one day, after turning 70, he began to notice persistent discomfort. It wasn't a sharp pain, but rather a feeling of irritation, as if the skin on his penis were overly sensitive or even cracked. At first, he attributed it to a bad night's sleep or his age, but the discomfort persisted. Miguel felt frustrated and confused. "Doctor," he told me, "I no longer understand my own body. What used to give me pleasure now causes discomfort that takes away my desire." His story is not unique. Reduced natural lubrication, more fragile skin, and decreased sensitivity in certain areas can make techniques based on intense friction counterproductive. Overly vigorous or repetitive stimulation without adequate lubrication can irritate the skin, cause microabrasions, or even worsen pre-existing conditions such as Peyronie's disease if you are already predisposed to it. But this is where the conversation becomes hopeful. The solution isn't to set aside self-care and pleasure, but to learn to approach it with a new perspective, with more gentleness, more attention to your body's signals, and, yes, with some practical adjustments. Think of it like a dance. If you were dancing a fast tango before, perhaps now it's time to explore a slower, more sensual waltz. This involves being kinder to your body. Sometimes simply slowing down, decreasing the pressure, or changing the surface area of contact can make a huge difference. Exploring the use of water-based lubricants, for example, is a simple but powerful change. Mature skin benefits immensely from extra moisture to compensate for natural dryness. We can also think about different types of caresses. Perhaps direct, constant stimulation is no longer the most suitable option, and instead, you may discover that a lighter, more scattered touch, or even focusing on other erogenous zones you may not have previously considered, can awaken renewed pleasurable sensations. It's essential to understand that these biological changes don't mean the end of pleasure, but rather an invitation to creativity and a new way of exploring sensations. The decrease in nerve sensitivity, for example, teaches us that your body's pleasure map may be reconfiguring. If the areas that were previously the focus of your attention no longer respond with the same intensity, it's time to expand that map. You may discover that a gentle caress on the back of your neck, a touch on your inner thighs, a massage on your earlobes, or gentle stimulation of your perineum can awaken equally gratifying, though different sensations. The key lies in conscious exploration, listening to your body's new signals, and allowing yourself to discover the unexpected with an open mind. Regarding the decline in testosterone, it's true that this hormone can influence the frequency of spontaneous desire and sexual energy. However, don't view it as a loss or deficiency, but rather as a transformation. Your desire may become less on demand and more cultivated. Perhaps you now need more time to ignite, more fantasy, a more conducive environment, or a deeper emotional connection to awaken the spark. This doesn't diminish the validity or richness of your experience. It simply redefines its manifestation. A healthy lifestyle, with a good night's rest, balanced nutrition, and regular exercise, is also a powerful ally in supporting your hormone levels and overall well-being, helping to maintain that inner fire. Finally, alterations in blood flow are often the cause behind changes in erections, which may become less rigid or more difficult to maintain. Here, the greatest gift you can give yourself is to release the pressure to perform. Sexual pleasure is vast and not limited to penile rigidity. Intimacy, prolonged caressing, manual or oral stimulation, or the use of vibrators and other accessories designed for maturity can open up a range of incredibly satisfying experiences. The mind is an extremely powerful tool. Fantasy, redefining. What you seek in an intimate experience and open communication, with yourself or with your partner, can guide you toward a fuller, richer sexuality tailored to your stage of life. Now, by understanding that sexuality evolves, we can avoid some common mistakes that often limit pleasure in later life, transforming them into opportunities to enrich intimacy. The first mistake is using the same amount of pressure, skin, and tissues become more sensitive over time, and what was once stimulating can now be uncomfortable or even reduce pleasure. The solution is to loosen the pressure. Explore softer, more delicate, and longer touches. Subtlety often amplifies pleasure and connection, allowing the nerves to respond more sensitively to less aggressive, more conscious stimulation. It's an invitation to gentleness and mindfulness. A second common mistake is going too fast. Arousal in later life isn't always instantaneous. It often requires more time to build, more foreplay, a more gradual buildup of desire. Rushing because of a past performance expectation only leads to frustration and superficial pleasure. The solution is to use slower movements. Enjoy the foreplay, the deep connection. Allow pleasure to develop at its own natural pace, like a gently unfolding melody. Patience enriches every moment and allows arousal to reach its full potential. The third, and very common mistake, is ignoring lubrication. Natural fluid production can decrease with age in both sexes, leading to friction, discomfort, or even pain during intimacy. Assuming that lubricant is unnecessary or a sign of a problem is missing out on a great help. The solution is to apply water-based lubricant. Consider it a tool to enhance the experience, to ensure smooth glide and more fluid sensations. It's an essential ally for comfortable and deeply pleasurable intimacy, transforming potential. Discomfort into unhindered enjoyment. The fourth mistake is forcing climax. Sometimes the pressure to reach a specific orgasm or at a certain speed or to achieve it in a certain way can generate performance anxiety and, paradoxically, make it more difficult to achieve. Releasing this need for a predefined outcome is key. The solution is to let the experience unfold naturally. Focus on the process, the shared sensations, and enjoying the moment without a rigid goal. When this pressure is released, the body often responds more freely, allowing climax, if it occurs, to be more organic and satisfying without self-imposed expectations sabotaging it. Finally, the fifth mistake is ignoring your body's signals. Sometimes, because you want to maintain a forever young image or because you don't want to admit change, you ignore signals of fatigue, discomfort, or that something doesn't feel right. This can lead to unsatisfying or even harmful experiences in the long run. The solution is to adjust to what your body feels. Learn to listen to yourself. If you need a break, take it without guilt. If a position or type of stimulation is uncomfortable, communicate it or explore another alternative. Honoring your body and its current limits is the greatest act of self-love and the key to a sustainable, fulfilling, and authentically your sexuality at this stage of life. Now that we've explored these common mistakes and their solutions, I invite you to shift your focus. It's not just about avoiding what doesn't work, but actively embracing what can work beautifully for you today. Sexuality, at this stage, becomes an art of adaptation, a conscious dance with the changes in your body and mind. It's not a decline, but a reinvention, an opportunity to discover new depths of intimacy and pleasure. It's like adjusting a ship's sails to a new wind. The journey may be different, but no less exciting or satisfying. In fact, it's often deeper and more meaningful. Think about it. Your lives have evolved, your experiences have accumulated, your perspective on the world is richer. Why shouldn't your sexuality reflect that same maturity and wisdom? Adapting your routine isn't a sign of weakness, but of emotional and bodily intelligence. It's a strategy to maximize enjoyment and minimize any potential frustration. It's taking control of your sexual well-being and shaping it to suit you. One of the pillars of this adaptation is choosing the right moment. Often, in youth, spontaneity reigns. But over time, energy levels, digestion, accumulated fatigue, or even medication can influence this. It's not about eliminating spontaneity completely, but rather being strategic. Imagine trying to enjoy a delicious meal when you're in a hurry or exhausted. It wouldn't be the same, would it? A similar thing happens with intimacy. Consider when you feel most rested and in the best mood. For some, mornings, after a restful night's sleep, are ideal. For others, a quiet weekend afternoon, after a nap or a moment of relaxation, may be the perfect time. Listen to your body. When do you have the energy, not only physically, but also mentally and emotionally, to fully engage in the experience? A patient told me that, in the past, he always waited until nighttime, but ended up so tired that the experience was lukewarm. When he tried it in the morning on weekends, his connection and enjoyment skyrocketed. There's no one-size-fits-all formula, but there is one of his. And of course, linked to the timing is the preparation of the environment. Don't underestimate the power of the environment. A space that invites relaxation, privacy, and sensuality can completely transform the experience. Imagine a tidy bedroom with dim lighting, perhaps soft music, pleasant aromas. All of this already sets the stage for emotional connection. But now, let's think about physical appearance and the crucial importance of body position. As we age, our bodies change. Joints may ache, flexibility may decrease, and physical endurance may not always be the same. This isn't an insurmountable obstacle to intimacy, but rather an invitation to creativity and intelligent adaptation. Position isn't just a matter of comfort. It's a powerful tool for maximizing pleasure and minimizing any discomfort or pain. For example, for those with lower back pain or arthritis in the hips, certain positions that require excessive flexion or support at the wrists can be problematic. This is where we can explore options that redistribute weight, minimize strain, and allow for comfortable access. Consider positions where both partners lie on their sides, facing each other, or behind each other. This can reduce pressure on the spine and hips, allowing for smoother, more sustained movement. Another valuable option is to use the support of a bed or an elevated surface for the partner who needs more stability or less physical effort. If one partner has knee problems, for example, standing or kneeling can be painful. Sitting on the edge of the bed or using cushions to elevate the hips can make a significant difference. And this brings us to support tools. We're not talking about complex devices, but something as simple as pillows, bolsters, or even rolled towels. These elements are your allies in creating the perfect position. A strategically placed pillow under the lower back can relieve tension, or under the knees can relax the pelvis. For penetration, if depth or angle are a challenge, a cushion under the hips can adjust the pelvic tilt, allowing for a deeper, more pleasurable connection without excessive effort. I've had couples tell me that simply adding a firm pillow under one partner's lower back completely transformed their experience, going from uncomfortable to absolutely wonderful. It's not about complicating the act, but rather optimizing it with ingenuity and attention to the body's needs. In addition to cushions, we can consider using textured tools. Sometimes, skin or erogenous zones become less sensitive over time, or we simply seek out new sensations. Small, soft massagers, or even fabrics with interesting textures, such as silks, soft wools, or materials with small bumps, can introduce a whole new world of tactile sensations. This doesn't replace human contact, but rather complements it, adding a different dimension to foreplay or mutual exploration. Imagine stroking your skin with a soft feather, a very soft bristled brush, or a natural sponge. These small touches can awaken nerves that may have been dormant, or simply offer a new and exciting experience. The key is experimentation and communication. Talk to each other. Do you like this? Is this better? What if we try? There are no right or wrong answers, only personal discoveries. Mature intimacy is a journey of continuous exploration and mutual adaptation. But beyond the physical tools, the true driving force of intimacy lies in our minds and emotions. This is where we can rediscover and redefine pleasure. We often approach intimacy burdened with expectations of how the act should feel or be. These, fueled by culture or past experiences, act like invisible shackles, preventing us from being present. If we chase an ideal or a memory, we miss the rich reality of what's happening now. True liberation, my dear ones, begins with letting go of those expectations. It is an act of deep self-compassion and respect for the evolution of our body and mind. Accepting a different kind of pleasure is opening ourselves to a universe of sensations and connections never before explored. Not all pleasure has to be explosive. The greatest joy can lie in the tenderness of a caress, the warmth of an unpretentious hug, shared laughter, visual connection, or the simple comfort of feeling seen and desired. Stillness, slowness, and emotional intimacy can be as, or more, rewarding than any physical peak. Consider Clara and David. After health changes affected David's erectile function, both became frustrated. They decided to explore. Their intimacy stopped being defined by penetration and instead focused on connection. They rediscovered pleasure through massage, caressing, and intimate conversation. They learned that Clara's breath, or him holding her hand, were sources of profound satisfaction. They discovered a broader, more tender, and deeper intimacy, free from the pressure of a result. This is self-care at its finest. It's honoring your body and emotions today, without judgment. It's understanding that sexuality is fluid and evolving. Allowing yourself this unbiased exploration is the greatest gift you can give yourself, opening the door to a stage of unexpected intimate fulfillment. My dear ones, we have explored how letting go of expectations and embracing the evolution of our intimacy is not a loss, but a liberation into a universe of vaster and more tender pleasures. We have learned that true joy lies in self-compassion, deep connection, and the acceptance that sexuality is fluid and constantly redefining itself, opening unexpected paths to fulfillment. Now I would love to hear from you. What different kind of pleasure have you discovered on your own intimate journey? Share your reflections in the comments. If this conversation resonated with you, I wholeheartedly invite you to subscribe to the channel. Activate the bell so you don't miss our future conversations, and share this message with someone who could also benefit from it. Thank you for joining me on this journey of self-discovery and growth. A big hug, and I'll see you at our next meeting. With love and light, Dr. Elena Castillo.